Thanks for joining us on Wellness Talk Radio. I'm Chris Costello, and today we are talking with Dr. Alexander Mauskop, author of What Your Doctor May Not Tell You About Migraines, the breakthrough program that can help end your pain. Dr. Mauskop, thank you so much for joining us today.
Thank you for having me, Chris.
You have founded the New York Headache Center. You're a fellow at the American Academy of Neurology. You've come up with an amazing migraine product. How did this all come about?
Well, actually, it was an accident. I did my training in neurology first, and then I spent 2 years at Memorial Sloan Kettering Cancer Center studying pain, and I was a pain fellow for 2 years. And there were no headache specialists at the time. And somehow, by accident, I fell into this field, and I'm very happy that I am in this field. And the field has grown over the past 20 years, and now we have actually certification of headache medicine specialists. We have a special test that you can take and become a headache expert.
And you founded the New York Headache Center. When did you do that?
I did it in 1987, before we had any of the new, very effective medications for headaches. So it was very difficult to treat patients with headaches in 1987. We had a couple of drugs that were not very effective, had many side effects, and the choices were limited. And that is why I was very interested in alternative therapies, non-traditional therapies like acupuncture. I've been a licensed acupuncturist for over 25 years. And vitamin supplements, and by accident I got involved with the research on magnesium and headaches. So that's been my life's work, magnesium and headaches.
So your patients came to you, and kind of through that, you started looking at all the angles and figured out a real cure for these headaches.
Well, yeah, sometimes cure, but often just relieving the symptoms. And true cure is sometimes not possible because many headaches are genetically determined. So you can improve people's quality of life by eliminating most of their headaches. But the underlying brain sensitivity to have a headache may still linger there. So the people with headaches have to be careful about regular sleep schedule, managing stress, and avoiding certain triggers. So cure is a strong word. Sometimes we can cure it, sometimes we can help. But the good news about the headache field is that it's very gratifying. I can help, I would say, 95% of my patients.
Right. Personally, I have suffered from migraines for many years now, and I'm not sure if people that don't get them can even grasp what it really means, because I want to start off there with, what is a migraine? What does it feel like to a person, and what are the symptoms of all the patients that you've dealt with?
Right. So in a way, I'm saying I'm lucky that I do have occasional migraines. The reason I'm lucky is because I can definitely relate to my patients' experience, because many of them will tell you, just like you said, if you've never had a migraine, you don't really know what it feels like. It's not just a headache. So having had a few, and not so few actually, but mine are pretty manageable, I can tell that migraine is really a serious, debilitating condition that causes severe disability, and everything in this country is measured in dollars, so it costs billions of dollars of lost productivity, and has an immense emotional toll on people's lives. Because not only you're suffering when you're having a migraine, many people live in fear of having another headache. And so the life is very unpleasant all the time, even if you're not having a headache. You just keep worrying about having one. Right,
and it's such a long cycle, too, because it's not just the day or 2 days that you have the headache, it's the time before and the time after recovering, and, it can blow out a whole week, basically, for a lot of people. And so what are some of the symptoms of migraines?
First of all, severe headache, and then many people will get nauseous, sensitive to light, noise, smells, movement. So everyone has a different set of symptoms. Some people get auras, which is a warning that comes before the headache, a visual disturbance that occurs in about 20% of people with migraines. You know that something's going to happen because your vision suddenly gets blurry, or you lose part of your vision, and then you get a severe headache after that. And unfortunately, some people, you mentioned that people get headaches for a week at a time. Unfortunately, there are millions of people who have headaches every single day, and that's what we see in our headache clinic. People have headaches almost every day or every day, and the statistics indicate that we have a couple of million people like that. And many patients who come into my office say, have you ever seen someone having a headache every day for 2 years? And my answer is, unfortunately, we see that every single day.
That is unbelievable. How do these people function?
Some do not. Some don't function. A few go on disability. Some just barely function. Some take medications, and in some cases, medications can make the problem worse, particularly caffeine-containing drugs like Excedrin, Furostat, Furanol, and narcotics also can make headaches worse. Unfortunately, those drugs are still very widely prescribed and used, and they often cause this worsening of headaches. We call it rebound headaches, or medication overuse headaches.
And how do they do that? Why do they do that?
Well, caffeine has good properties, and if you take it once in a while, it helps relieve the headache. If you do it regularly, anyone who drinks a lot of coffee knows if they don't get that cup of coffee in the morning, they'll get a headache. It's withdrawal from caffeine that gives you a headache. So your body becomes used to it. Same with narcotics. Your body gets used to it. You need to take more and more, and it works less and less. So people come in and tell me, Furostat is the only thing that works for me. And I said, well, if it works, why are you coming to see me? It works less and less, and I have to take 10 pills a day and 15 pills a day, and it's a problem. So first thing we do is get them off all caffeine-containing drugs, all narcotics, and often the headaches get better just by getting them off those drugs.
So someone suffering from headaches, do you recommend that they avoid caffeine for the most part?
Absolutely.
Mm-hmm. Okay.
Caffeine is a big culprit, and Starbucks is the worst offender because ounce per ounce they have 3 times more caffeine than any other brand. And you get this big tall latte or any other coffee, and you get triple the amount of caffeine.
And it is addictive. Now, when people are weaning off of caffeine and coffee, do they usually do it slowly or just kind of cold turkey? How do most of your patients do that?
I usually tell them to do cold turkey, and I give them several medicines to cope with withdrawal headache, which can be pretty difficult to manage. First it gets worse before it gets better. So usually you can manage it fairly easily with several medications. I give them a different kind of pain medicine or an anti-inflammatory drug. Or I often give them my new product, Migralex, which is aspirin magnesium combination that works very, very quickly and doesn't upset your stomach and does not cause rebound headache.
People can go to migralex.com to find that?
That's it. That's where you get it.
Great.
Amazon does our fulfillment, so you can read people's opinion about Migralex on Amazon.com.
Great. And then in your book, What Your Doctor May Not Tell You About Migraines, and I love that title because I think a lot of times people go to their doctor with migraines and sometimes they don't feel like it's really taken that seriously,
You're right, Chris. It's a very underappreciated condition. Many physicians, especially those who've never had a headache themselves, will dismiss this as a psychological problem, and neurotic women suffer from that. And they will give them a prescription for ibuprofen or something that's totally ineffective for their headache. And the headaches are often misdiagnosed. People often think they have sinus headaches because they have a slight congestion, or they have tension headaches. In fact, they have the migraine type of headache and should be treated more aggressively than just with ibuprofen or narcotics like codeine and Percocet.
Now, I'm also interested to ask you, what is you mentioned genetic component in this before. What is the genetic component of this? In our family, it seems odd. Nobody in the last generation seems to have had migraines, but most of the children have them. Is that common?
Yes, it's common you can skip a generation, and we are finding now specific genes for migraine. There's a rare type of migraine called familial hemiplegic migraine, and we have one specific gene identified for that, and there is a lot of research going on looking at genetic abnormalities in the regular migraines, the common migraine. And it seems that there are many different genes that can cause migraine, so it's not a simple, straightforward genetic disease where you can find one gene and fix it eventually. But there are many different genes and different families. And we are now about to start a project with a researcher in Australia looking at genetics of migraine and magnesium absorption. So there's an overlap. We have families where people have low magnesium levels and they have migraine headaches and other problems because of magnesium deficiency, which runs in the family.
Right, and I've got to do a testimonial here, and I talked to Dr. Mauskop Mauskop last week was having migraines, and he mentioned the 600 milligrams of magnesium, and it's been like a miracle. So this is definitely worth looking into if you're suffering from headaches. It's What Your Doctor May Not Tell You About Migraines by Dr. Alexander Mauskop and Barry Fox. And so, Dr. Mauskop, let's talk about the dietary triggers for migraines.
So many people will know if they have a glass of wine, they'll get a headache. That's not that difficult to figure out. For many people, chocolate is a trigger, or caffeine, as we've talked about. There are subtle triggers for some people, such as even healthy foods like raisins, bananas, and yogurt for some people. So there's a long list of potential triggers, and for many people, food does not make a difference, but for some, it can make a difference between having no headache and having a headache every day. So the best way to identify your triggers is to keep a diary. And actually, I just launched recently an iPhone app to keep track of your headache. And so if you have an iPhone or iPod, you can download it. It's a free app, and you can it's called Headache Relief Diary, and it automatically downloads temperature and humidity and barometric pressure in your location. So you can actually look at not only dietary triggers, but also environmental triggers such as barometric pressure and temperature. So it's a nice, neat, and free application that you can download for your iPhone. So food, again, back to the food. Food is a trigger for some people, but not for all.
And do people tend to crave the things that they react to, or is that a myth?
The only thing that I hear a lot is that chocolate. And there is always a debate. Are you craving chocolate because you're going to get a headache no matter what, and you may as well have chocolate, or craving chocolate, eating chocolate will trigger a headache, and if you don't eat the chocolate, you will not get a headache. So we don't know that. There's no science about it, but many people will know that chocolate or something with caffeine will give you a headache. I know from my personal experience, and I do get occasional migraines, that a very good chocolate, I like dark chocolate, not milk chocolate, and the more cocoa in it, the more likely I'm going to get a migraine from it.
Interesting.
Wine is another big trigger. Yep.
Interesting. So the dark chocolate tends for you to trigger it more.
Right, because, dark chocolate is supposed to be healthy.
Right, of course, yeah.
Opens blood vessels and works on those to improve circulation, but whenever you have something that works on blood vessels, you can get a headache. And actually, on my blog, I had a piece about resveratrol, which is the active ingredient in red wine, supposed to be good for you.
Right.
But some people get a headache from that, from the extract of red wine that's supposed to make you live longer.
Right. And Dr. Mauskop, where do people find your blog?
Well, I have a couple blogs. So one of them will be on migralex.com. You can just look under the blog there. And the second one is nyheadache.com. That's my practice website. But migralex.com is, I'm more active in that blog. And then we have also a Twitter. I'm tweeting as well. Very interesting tidbits of medical information, mostly related to headaches, but not always. So if you look at Migralex on Twitter, you'll find my tweets there once or twice a day.
And so with the food triggers, another thing you talk about in your book is the elimination diet. And how does one go about doing that?
That's a difficult process. Elimination diet means you stop eating everything and you introduce one item every day. So first you start eating just apples or potatoes or bread, and then every day you add one more, and you watch and see what happens to your headache.
And you actually can survive on that. I've done that, and it's not so bad, rice for a few days, and now a lot of people...
Have you found what your trigger was?
No, I always do it just enough to feel a little better for a few days, and then I go back to my habits. I'm sure we'll get there someday, but some people do experience, though, I've heard that, when they do the elimination diet, they actually feel worse for a few days. Have you heard that?
Yes, that's possible. No, there's several reasons for that. One, if you are hungry, and often on these diets you tend to feel hungry, you can get a headache from hypoglycemia. The other important thing about dietary triggers is preservatives and all kinds of sugar substitutes. They also can give you a headache. So people with headaches should avoid eating anything processed like pickled, smoked, dried, cured. All that stuff has many nitrites and sulfites and all the other chemicals that can give you a headache, as well as the NutraSweet and things like that. For some people it's a trigger, for some people it's not. I'm not saying that it is a trigger for everyone, but if you have headaches, you should look at those.
Right, and I did find the elimination diet useful as far as it did point me to realizing, that dairy and wheat were difficult for me, basically. And
that happens. Sometimes it's one or the other, either dairy or wheat. So that definitely is a possibility.
Right, and so you do become more aware of food and its effect on your health, I think. But just by doing that, it's an interesting experience to go through. Let's talk a little more in detail, though, because I'm not sure people really understand with the elimination diet how they go about doing it.
Right. The elimination diet, if you can't find the cause of your headache, then no matter what you do, and I guess I should first tell you what I usually recommend that patients do for their headaches. But if nothing works, then we go through this diet. But let me tell you first what we recommend. Number one, stopping caffeine. Number two, regular aerobic exercise, 20, 30 minutes, 5 days a week ideally. Relaxation training or biofeedback or meditation. It works very well for headaches if you do it on a regular basis. And then we recommend magnesium and several other supplements. And then we often suggest preventive treatments. Acupuncture is one option, Botox injection, and then medication. And dietary factors are also at the top of the list, along with caffeine. So if eliminating the most likely offenders doesn't work, that is eliminating cheese, chocolate, wine, too much sugar, and all the other artificial sweeteners and preservatives, if that doesn't work, then we will suggest elimination diet, which is you just keep a diary of your headaches. Otherwise, you will not remember how bad the headaches were. And the first day you eat there's no specific order for the food. You mentioned rice, and then you can add apples, and you can add maybe plain boiled chicken, and then you add something else. So it's a very lengthy, very difficult process. So I don't usually recommend that unless other treatments fail, and unless the person herself feels that the diet has something to do with their headache. Often you can tell that food contributes.
Right, and you go through this very much in detail in what your doctor may not tell you about migraines. So if people want to find out more and look at some of the foods and things, they can find that in your book.
Right.
So another thing you talk about is the triple therapy, and this is kind of like the holy grail, right?
Not exactly, no. I wouldn't call it holy grail, no. But one of the ingredients in this combination product is magnesium. That's probably the most effective agent. And I have, again, a list of other supplements, so I can give you a reader's full list. Magnesium, we start with 400. You took 600, which is fine, too. The only side effect of oral magnesium, if you take too much or if you take it on an empty stomach, it can give you diarrhea. So make sure you eat first. And we formulated Migralex, the magnesium-aspirin combination, not to cause diarrhea, the right proportions and very well absorbed, because absorption is a problem for magnesium supplements. People often take the daily supplements and nothing happens. And they might be deficient and could benefit from magnesium, but it just doesn't get absorbed. So in Migralex, absorption is not an issue, usually gets in very quickly. Second supplement that I would recommend is Coenzyme Q10, CoQ10. It's a popular supplement for a variety of medical conditions, for your heart, for Parkinson's disease, and there are a couple of studies showing that migraine sufferers can benefit from CoQ10. For migraines, we recommend 300 milligrams a day. And the cheapest place to buy it, because it's fairly expensive, is Costco. Someone just told me it will cost you maybe $20 a month. A regular store will be 2-3 times more. That's the second one that has scientific evidence that it works after magnesium. Third product is Feverfew. It's a good herbal product, has been around for many years. But the problem with herbals in this country, they're not regulated. So you really don't know what you're getting because there's no regulation of herbal products, unlike in Germany, where herbals are as strictly regulated as drugs. So German products tend to be better, or major manufacturers is what I tell people to buy. That brings us to a German product called Petadolix, or butterbur extract. We tested in a large study. I was one of the 3 participants in the study. We showed that prevents migraines as well. And there's a fish oil, one small study suggesting that 6 grams of omega-3 fatty acids, which is in fish oil, can help prevent headaches. And then there is vitamin B2, riboflavin, 400 milligrams a day, also helps headaches for some people. But it takes a while for riboflavin to work. So those are the top supplements that we recommend usually for headache patients. And you can start with one or two, definitely magnesium on the top of the list. And then you can introduce more. If the first couple don't work, we stop that and try another one. But unfortunately, it takes time. It takes months before you see if supplements will work. For you, it works much faster, it seems like.
Right, right. It was very kind of miraculous. It was really interesting. But now, is there anything where all of that is in one supplement, or?
There are several combination supplements. There is MigRelief, which has magnesium, B2 Feverfuse. There is MigraVent. There are several combination products which makes it easier to take. But I usually recommend individual ingredients lately. I used to recommend this triple combination, MigRelief, but I recommend that as well as individual ingredients for several reasons. Pregnant women, we do not want to take herbal products. Even though they might be safe, we have no evidence how safe they are. People who are very allergic to things, herbal products are just like any plant. You can have an allergic reaction to that. So, I often begin with magnesium, CoQ10, MigRelief. I still recommend that triple combination as well.
And are patients surprised when they come to you? And, some of this just seems so simple in a way. I mean, are they really surprised? I mean, so many of them are probably used to injections and pharmaceuticals and,
Right. Well, talking about injections, sometimes if a patient comes in with a severe headache and they've been suffering for a long time, I will give them an injection of magnesium, which gives the immediate relief. And the magnesium in the shot gives you enough magnesium for a month, and they get immediate response, and it's very gratifying for me as well. They get up and they say, I can't believe this. My headache is gone. I haven't had a headache-free day in months or years, and they can't believe it. For them, it's more miraculous than it was for you because it was so immediate.
Mm-hmm.
But for many, many people, we find that up to 50% of people with severe headaches have a deficiency of magnesium. But unfortunately, it's well known actually in medical field, but nobody recommends that. My colleagues often come and tell me at a medical meeting, we've given every possible drug, nothing worked, and finally we gave them a shot of magnesium, and it was like a miracle.
Mm-hmm.
Well, my answer to them usually says, why didn't you start with magnesium? It's so much safer than trying all those toxic drugs first.
Mm-hmm.
And they stop and think about it, and they still go on and first use drugs. Just the habit, I guess, most physicians have.
Right.
They don't believe magnesium can help, even though we have good scientific proof. We've published many articles on magnesium.
And and we can get into all of that, how much of it is marketing and just, greed too. It's just, but we don't want to go down that road, especially if we're talking about headaches. One of the things I wanted to ask you, Dr. Mauskop, was, how does one know the difference between a severe migraine attack and like a stroke? I mean, many years ago, I had an attack that I swear, I still wonder whether it was more than a migraine because I had slurred speech, I had, some paralysis, and things like that. How do you know the difference?
Well, a stroke has a set of very distinct features. Just having a headache without other symptoms doesn't mean you're having a stroke. Now, if someone has never had a headache and they suddenly have a very severe headache, typically people say, this is my worst headache of my life, that usually indicates to every physician that if it's the worst headache of your life, if you say those words, it means that you could have had a ruptured aneurysm in your brain. You might have had a stroke. But on the other hand, if you have a person who's had a headache for a couple of years and they don't change and they're very severe but are not associated with neurological symptoms, then you don't need to worry about a stroke, usually. But again, a new onset of headache, or if you've had migraines or severe headaches and then suddenly it's a different headache, or if you're having visual loss, which can happen with migraine aura, but if you've never had it before, that could be a sign of a stroke. If you have difficulty speaking, which you never had before, if you have numbness or weakness on one side of your body, if you have vertigo, spinning sensation, again, if you've never had that before, those are signs of something going wrong in your brain, possibly a stroke. If you have fever or stiff neck, you might be having meningitis, so you should also immediately seek medical attention. Even though you might have had headaches all your life, but if this is a different headache, something is unusual about it, you should immediately seek medical attention.
And is an MRI the only way to diagnose that, or?
Well, if you're having a bleeding stroke, like an aneurysm or a hemorrhagic stroke, a CAT scan often is the best test early on, and that's what you usually get in the emergency room. When you walk into the emergency room, they will do a CAT scan, which is good to show bleeding in the brain. MRI scan we do as a routine test, not so much in emergency rooms, but that can be done as well. If the CAT scan is suspicious of something and doesn't show enough information, we might do a spinal tap or an MRI scan.
And so patients that come to you, it sounds like 95% of them, it sounds like, you can actually give them quite a bit of relief from their headaches.
Right. We may not cure them, but we can help them.
Yeah. What's going on with the 5% that can't get relief?
Those are the tough ones. Those are the ones that keeps us busy. So we get referrals from other neurologists. So we often see people who've gone to several doctors, can't find relief, and so we have to think about all kinds of other options. And
right.
I never give up on my patients, and I tell them that I've never seen anyone who's tried everything. So we have always other options to try, and you never know which one is going to work. And those options include Botox injections, magnesium injections, and we do use medications, even though I prefer not to use drugs in my patients. For many of them, medicine is unavoidable. So when we have a long list of maybe 40, 50 different drugs that we can use to prevent headaches, and we often keep trying and combining treatments. And there's also a psychological component, even though headache is not a psychological disorder. If you have a major psychological issue overlying this headache or any other medical condition, it's very difficult to get rid of it unless you really figure out what else is driving the headaches, what's contributing to them. It's not the cause of your headache, the psychological factors, but they make them worse. Many people with chronic pain and headaches have a history of being abused sexually, physically, post-traumatic stress disorder. What those things do to your brain is make your brain very, very excitable. So they're always hypervigilant. They're always one traumatic experience can affect the way the brain functions, and you're more prone to having chronic pain problems. But it's treatable. Even those things with combining cognitive behavioral therapy with drugs, you can bring that under control. So that's not hopeless. If you even had a very traumatic experience in your life and you have chronic pain, it's still manageable. But it's more difficult to treat those patients.
And so do you find that you have to spend a lot of time with your patients to actually get to the causes of the headaches and to find something that works for them? Right.
So we do spend, for difficult, unfortunately, many patients we can help pretty quickly. But there is, again, 5%, we really have to work real hard, and sometimes we fail. I cannot say we have a 100% success rate. And then we may refer persons for an inpatient treatment in a hospital for a week or so, where people go in and get intravenous medications and intensive counseling and physical therapy and injections. Those are very few patients, but sometimes we do that. We refer them to inpatient headache clinics. There are 3 in the United States that are very good. One is at Cleveland Clinic, one is in Chicago, and one is in Ann Arbor, Michigan. So there are 3 inpatient headache clinics where we refer our very difficult patients.
Dr. Mauskop, why don't you go ahead and mention your New York headache website for people that are interested in finding out more about that?
Right, nyheadache.com.
Great.
And the website for our new product is Migralex, migralex.com, which is, I find many people tell me that for their headaches it works even better than prescription drugs. And I spent many years developing it, and we spent a year making sure it works very quickly, because for many headache patients, speed of onset is very crucial. If it doesn't work quickly, the headache goes out of control and it's too late. So this product, some people tell me, works in 20, 30 minutes, the headache goes away. So it's a good, it's safe on your stomach because magnesium acts as a buffer to protect your stomach. So aspirin will not upset your stomach, unlike Excedrin or regular aspirin. So it's safer, faster, and better product than even for some patients, even prescription drugs.
Great, and it doesn't have the rebound effect that you can get with the caffeine products.
If anything, aspirin may have a protective effect. You will not get rebound.
And are you still seeing patients in New York?
Very busy, seeing a lot of patients.
Great. Do you have people that travel to you? And
the furthest was from SoFi, Chile. She comes actually every 3 months to get her Botox injection. There's one coming from Australia soon. Next month, somebody emailed me.
Wow, great. It's the excitement of the internet there, huh? You can
Right.
reach the whole world. Now, can children get migraines? We haven't talked about that yet.
Oh, yes, absolutely. And many headache sufferers will tell me that they remember as a young child having headaches. Even kids who cannot speak have migraines. And how do we know? They often just get pale, throw up, and as soon as they can verbalize it, they'll say, my head hurts. So it happens at a young age, but the increase occurs at puberty. So girls at puberty suddenly have 3 times more headaches as boys. So at puberty and throughout the reproductive years, women have headaches. About 18% of women have headaches, and about 6% of men. So it goes up in 20s, 30s, 40s, and then goes down in the 50s, 60s. Becomes less common. So kids definitely suffer from headaches. They're real. And parents often dismiss them as the child maybe is just copying me and wants to get a schoolwork. No, always take the complaint seriously. It's usually a headache. If a child says, or an adult, I have a headache, you have to believe them. It's very rare that somebody makes these things up.
Right. And what's the youngest age you've heard of?
Well, again, before even the child could speak, 2 years old.
Oh, my goodness.
But I don't treat anyone below 10.
Mm-hmm.
10-years-olds I do treat with headaches.
Mm-hmm.
There are not enough pediatric neurologists in this country to treat all the headache patients, kids, that is, with headaches. So I do see them.
How many are there?
Again, very large number. 6% of kids until puberty have headaches, 5-6%. After puberty, again, girls, 18%. Very common. Stress is a big factor for kids. People say, why would a child have stress? Well, they all have their own worries.
Mm-hmm.
And they worry about schoolwork and all the social stresses, and that often contributes to their headache.
Right. Yes, it's funny you mentioned that. My son, 7-year-old, the other day, he seemed stressed, and I said, "Is something bothering you?" He said, "Yes. I'm worried that I'm stressed that you're going to take my video games away."
Right. Yeah, and many other stresses they will not even share with us.
Right. Yes, he didn't want to. He said, "You're going to laugh," and I said, "He's right."
Yeah,
you know?
I remember not telling my parents about things that bothered me because they seemed like silly or like embarrassing. I wouldn't tell my parents.
Right, and yet they worry about it. And now, yeah, I know also I was shocked the other day talking with an author that mentioned there's only something like 7,000 child psychiatrists in the country. That just really shocked me.
Right, and very few pediatric neurologists as well, so we need more doctors.
It's especially these days where you're hearing so much about kids that are struggling and having problems and developmental disorders, all sorts of things. So, Dr. Mauskop, what else do people need to know? I mean, you're obviously you've got so much knowledge about headaches and their treatment. What else would you want to share with them?
Right, so the main message that I'd like to give your listeners is that there is help. Do not suffer from headaches. Don't accept doctors who tell you there's nothing you can do about it, or if they give you a drug or two and it doesn't work and you have to give up. The main message is you really can control your headaches. You don't have to let them control your life. And there is a long list of things you can do without having to resort to prescription drugs if you're afraid of side effects. So the big message is go get help.
Great. And keep trying. If you don't get what you need, go to the next guy or call you.
Yep. All right. Or just check our website, migralex.com, nyheadache.com. And there are many other resources on the internet. You can really educate yourself and help yourself, just like you did.
Yes. Well, and I have to thank you. It's been wonderful. And thank you so much for spending the time with us on Wellness Talk Radio. And we look forward to hearing what you come up with next.
Thank you, Chris.
All right. Thank you.